second, everybody. All right. All right. I'm actually going to keep it like this so I can get a sense of the slides that are coming up. And feel free to minimize, on the right-hand side of your screen, you probably see the boxes that have the participants. Please feel free to minimize it so that you can see all of the slides. All right. So for those of you that came to the previous training that I did a couple weeks ago, or if you participated in a presentation I did back in the fall, you may see a few of the slides that are similar. And I did that on purpose because I want to continue to ground us in this work and really help to just embed this information in a different way. So sometimes it doesn't hurt to see some of the same things over again. But this focus of today's training is really going to be about how do I take this information, my understanding about trauma-informed practice, and really how does that apply to an organization? So, and what that could look like actually in practice at a setting that I might work in or frequent. So we're going to talk a little bit about that. Hang on. What I say in front of any training that I do or any meeting that I facilitate these days is just a reminder of that it's important to take care of yourself first. So please do whatever you need to do during this next hour, hour and a half while we spend this time together. If you want to keep your screen off, that's fine. If you need to step away to use the restroom or get a drink of water or just stretch, please do whatever you need to do to take care of yourself during this time. You said you can't pour from an empty cup. You need to take care of yourself first. So please know that during this time today, I really encourage you to do whatever you need to do to take care of yourself. So real quick, the goals for today, I'm going to be covering briefly kind of just what are the components of a trauma-informed organization. So if we say, I'm working towards having my organization be more trauma-informed, what would that look like? What are some of the kind of components of that? What are some of the areas that I would be addressing in my setting if I was to be more trauma-informed? So we're going to go over that. And then I'm going to end with kind of, well, then what are the next steps? So if I, after today's training and I decide, this is something that we really want to start undertaking maybe at the setting that I'm in, how do I go about this? Where do I begin? So we're going to talk a little bit about the process or steps for embedding more trauma-informed practices and policies into your setting. And then at the, as I've said before, you will get a copy of today's slide deck. So you'll get a copy of all these slides. And then I'm also going to be sending Patty tomorrow a document that actually has some additional resources for you. So later I'm going to be referencing some organizational surveys or environmental scans you can actually use in your setting. So I'm going to be sharing some examples of that with you. So you'll actually have an opportunity to have those and start to be able to use them. So again, you've all seen this before, but just a reminder, when we talk about what is trauma, what is a trauma-informed approach or what is trauma-informed practice, we typically use SAMHSA's definition of trauma-informed care, which are those 4 R's. So again, those first 2 R's is really just realizing the widespread prevalence and impact of trauma. So really having a good understanding of all the different ways that we can be impacted, the different things that could be potentially traumatizing or harmful to ourselves. We understand just kind of the prevalence. We understand that so many of us are carrying things with us, experiences that we've had from childhood or even current. There's often layers and layers of things that we are carrying in, each day. People often use the term the invisible backpack of stuff that we're carrying. So ourselves are carrying it, but also those that we're serving, our colleagues, our staff are often kind of carrying this invisible backpack of stuff. Previously I've used the iceberg analogy, and I've shown an image of the iceberg. We often just see that tip of the iceberg, but there's often layers and layers of things that we're carrying with us, but you often just see what's at the surface. So if we have that realization, we also need to be able to recognize how we're impacted, how we are impacted, how our clients, how our colleagues, our family is impacted by all this stuff that we've experienced. So really being able to recognize the signs of how we're impacted. If we have that awareness of realizing and recognizing, then we need to hopefully respond in a different way, that we are going to respond from a place of compassion, from a place of empathy, from a place of curiosity. So being more curious about what else might be going on. Really reframing the way we look at behavior. Again, coming from a place of understanding. And hopefully, we are also going to be working hard to not add additional trauma whenever possible. Because as we've said previously, sometimes the settings that we work in cause additional trauma. But whenever possible, we are working hard to not add additional stress or re-traumatize. So really learning how to recognize, how to not add more stress. And we're going to talk a lot more about that today when we talk about kind of what this looks like in our places of work. I shared this last time, this slide. Those 4 R's are those 4 key elements that kind of ground us in this work. And SAMHSA also has something that they call the 6 principles. So when we start thinking about how we might make changes in our setting or our place of work, we need to be thinking about how we are incorporating some of these 6 principles. So how are we making sure that our setting is safe? How are we making sure that our setting and our practice is coming from a place of trust and transparency? How are we really trying to incorporate individuals' voice and offering choice when possible? How are we making sure that our staff and those that we serve have a voice in the process? How are we making sure that we are attending to cultural, historical, gender issues? How are we offering kind of this peer support and collaboration? So again, I want you to just be thinking about like that lens when we start going into, in a setting, if we're going to be making trauma informed, how are we trying to, whenever possible, incorporating some of these elements? This really is kind of that lens that we hope to be using when we're looking at our setting, when we're looking at our physical spaces, when we're looking at some of the practices or policies we might have in our setting. We should be having these principles kind of in the back of our mind. All right, so let's get into, we have this foundation, have this understanding. Well, how does it actually apply in a setting? So how does it actually apply maybe at my place of work? What does that look like? So this slide comes from the Center for Healthcare Strategies. They have a document, and I'm going to share this link with you when I share my resources after today. But this Center for Healthcare Strategies had a document called The Key Ingredients to Creating a Trauma-Informed Health Setting. These are some of those key ingredients. But these key ingredients apply to other settings beyond healthcare. Now, when they say key ingredients, these are just some of the things that if you are going to try to become a more trauma-informed space, these are some of the kind of key areas you'd hopefully be attending to. Now, if you work at a library, for example, you're not going to be screening for trauma. You're not going to be necessarily doing trauma-specific treatment. But there are some key ingredients in here that you would be doing. So, for example, you're going to want to make sure that you're creating a safe physical and emotional environment. You're going to want to make sure that you are building a trauma-informed workforce, meaning all staff, regardless of their role, should at least be grounded in a basic understanding about trauma and resilience. So thinking about, are there opportunities for staff and volunteers at your setting maybe to attend, a foundational training on trauma and resilience, which is just a very introductory training on understanding what trauma is, the ways we're impacted, and strategies to build resilience. That type of training is good for anybody, regardless of what role. It really helps to create this common language amongst our community. It helps, again, to shift the lens we're using when we're engaging with individuals. And again, it helps to build empathy and compassion and understanding. So regardless of the setting you're working in, creating a safe space, which I'm going to give more detail about what that is really important. And having a basic understanding about trauma and resilience. So making sure that your staff, volunteers, anyone, at least at the front end, at a minimum, has just a basic understanding. And that could be, like you said, through having them attend a training or using there's just many different ways you could do that. Within our organization, where I work in Richmond, we have now incorporated in our onboarding for any new employee, any new volunteer, intern, or even board member, we've now incorporated that they need to watch the film Resilience. So it's a documentary that our organization has obtained. It's an hour long that gives the history of the ACE study, the Adverse Childhood Experiences study, and talks, basic understanding about trauma and resilience. We also have them participate in an introductory training on trauma and resilience, and there's a number of them that are facilitated around our community for free. And we usually give them the different opportunities to attend one of these trainings. But at a minimum, they have to attend at least one introductory training and a screening of the film. So at least that just kind of grounds them in this understanding. So even if they're not doing direct practice, even if they're just going to be sitting on a board, they still need to have at least this basic understanding. Now, for other settings that might be doing more direct practice, these other key elements are definitely going to come into play if you're wanting to be a more trauma-informed organization. In addition to what I've already said, you also may be, really making sure that you're addressing staff wellness, particularly if you're in a setting where the type of work that you're doing, the type of stories that your staff are going to be hearing and seeing, if there's the opportunity for your staff to be impacted by vicarious trauma or secondary traumatic stress, you want to make sure that you're attending to staff wellness in addition to some of this other stuff. And we're going to talk a little bit more about that in a second. Depending on your setting, you may also need to be screening for trauma. So for many organizations, especially in like a human service field, for example, when we have or healthcare, for example, when we have new clients that come in, there's often some type of an intake. that we're doing, some type of an intake or general screening that we're doing on the front end. So for some organizations, screening for trauma on the front end might make sense. And I'm going to give some examples of what that might look like, and also some things to consider and be careful of when doing that. But screening might be an important piece. Always making sure, we go back to that, having voice and choice, one of those 6 principles. You want to make sure that whenever possible that you are incorporating feedback and input from your staff, from those you're serving, your constituents. You want to make sure that this isn't just a top-down directed policy and procedures, that there is input from those with lived experience, that there's input from the community. So making sure that there is some opportunity for input before you're even making some of these significant changes in your setting, and that there's continuous opportunity for feedback. So even after you've made some changes, are there opportunities for people to still continue to be able to have voice and input? So I'm going to kind of go a little bit deeper into some of these key elements. So this is something I shared last time, but I just want to use it as kind of a refresher. Again, when we're thinking about coming into a setting and applying what we know about trauma-informed care, it really starts with that shift of how we look at behavior, look at the issues that are being presented, and a shift to focusing, instead of focusing on what's wrong, but on what's happened. And again, coming from that place of curiosity, wondering what else might be going on, wondering what else might be happening here, or what other information we might be needing that will help us better understand what we're seeing with those we're serving. So we're kind of, again, like shifting the lens of how we're looking at things. Whenever possible, we want to make sure that the practices that we have in our setting are not just focusing on the negative issues, but are also, there's opportunities to build resilience. So build, protective factors, build opportunities for recovery, and not just focusing on the negative. So just thinking about, a particular setting, what additional things might we be doing in the service that we're providing that can also help to build resilience. So, for example, if we are coming from, a mental health setting or even a child welfare setting, that we're not just focusing on trying to extinguish negative behaviors, that we're also, are there opportunities where we can help build up the skills of the person that we're supporting? Are there things that we can help to empower them to have a sense of mastery and feel successful? Are we trying to build up the other supports in their life, making sure that they have a connected, supportive individual in their life? Like, are there other things that we can be doing and not just focusing on extinguishing maybe negative behaviors or things like that? Are there other opportunities where we can also be trying to build up opportunities for success and resilience? And that it's going to look different depending on the setting. We want to make sure, like I said before, that we're addressing the impact of trauma exposure on staff and ourselves, especially if you're in a setting where you are doing some type of direct practice, and where you're going to be exposed to hard things. So I'm thinking about, I see on today's call, we have folks from juvenile justice, schools, social services, healthcare. In all of those settings, you may be exposed to upsetting stories, upsetting situations that might be happening right in front of you. Um, there might be significant loss. You might be exposed to traumatic material by reading someone's case history. There's many different ways that we could be exposed to this work, and it's often cumulative. It's happening kind of over and over, for time. And if we are wanting to be well in this work, we also need to be caring for ourselves and our staff. So making sure that if you truly are being a more trauma-informed organization, that you also are addressing staff wellness. So are you doing some training for staff on how to recognize signs of vicarious trauma? Are you, you know, helping to build strategies on how to take care of yourselves if you are experiencing symptoms of vicarious trauma? Um, are you, encouraging the use of a mental health day when needed? Um, are you doing, things to just, you know, notice and attend to the health of the staff whenever possible? So it kind of, when we talk about a trauma informed organization, on one hand, it's, we want to be looking at the practices that we use with our clients, but then also with our staff as well. And as I said, earlier, we want to make sure you're creating a safe working environment. And we're going to talk about physical setting in a minute, and what that means. So not just physically safe, but psychologically or emotionally safe. And I'm going to define that in a second. So whenever possible, especially when we're thinking about the physical space, we want to create an environment that promotes physical and emotional safety and is decreasing the stress on clients and staff. And again, I say whenever possible, because I do know that there are settings where there's things we have to do that are going to add more stress. That's just part of what we might have to do. But whenever possible, we really want to work hard on trying to lessen the amount of stress people are carrying and work towards preventing re-traumatizing whenever possible. I think about, some of our healthcare settings. There are certain medical procedures that we know are going to potentially traumatize or re-traumatize somebody, but we have to do them to save someone's life. So, but in that moment, when we're having to do something that can be pretty scary or that can be adding more stress or trauma to an individual, are there things that we can do in that moment to lessen the stress? There are things that we can do in this setting to maybe make it a little bit easier. When you think about, when a young child has to come in for immunizations and shots, that can be a very stressful time and often very scary for a young child, because it's going to hurt. It's going to cause pain and it can be very scary. But often as we think about how, when it goes well and you think about how the nurse or their doctor kind of sets that up, some will kind of make it, kind of try to be as as fun or as sensitive as possible. They try to explain what the procedure is, giving the child as much information as possible. Um, you think about the physical space of that setting, what it looks like, that it feels a little bit safer. There's, you're not going to necessarily take the stress away of you still have to receive the shot, but there's things that individual can do in that moment to maybe lessen the stress. So let's talk about the physical space for a second. So this is a before picture. So many of our settings, now I'm going to talk about, like, for those of us that work in a human service field, many of our settings, we often have to do some type of I said before, like an intake or an interview with the individual that we're about to be working with. oftentimes during that initial interview or screening or assessment, especially if they are a new client or a new patient, you're having to gather a lot of information. And sometimes the questions that you might be gathering might be pretty intrusive and may bring up some strong emotions with the individual that you're interviewing or questioning in that moment. The Sometimes the physical space can sometimes not help with the response that the person might be having. This particular setting is an interview room in a local mental health crisis office. So this particular office is where individuals in a local community who might be experiencing some type of mental health crisis would come to be interviewed. So they might be having thoughts of self-harm or self-injury. They might be incredibly distressed. They're in crisis. They're in a lot of pain. They're feeling overwhelmed. They're feeling at the end of the rope. They're feeling just a tremendous amount of pain and distress when they walk into this room. For some, they're at the point where they feel like ending their life. This space is not helping. So this is the space where that clinician, the mental health worker, is going to be asking this individual who's in distress some really hard questions about how they're feeling, about why they might be feeling this way, about maybe some very upsetting things that may have happened in their life that led to what they're feeling today. This physical space is not helping to lessen any of that stress or pain. Having these, just stark walls, looks very like a government building. There's nothing in there that's going to really help make it feel just a little bit warmer, a little bit safer. Now, you're not going to necessarily take away this individual's pain, but this space could be inadvertently causing some more stress. It's not a soothing space. It's not a welcoming space. It's very stark. There's a lot of different adjectives you can use to describe this space right now. And this is where someone's coming in significant distress. And this is where an adult or a child might be coming in. So when we talk about creating a safe space, like a physically safe space or a psychologically safe space, we really want to be considering a number of things. Every environment, I like this quote, we step into has an impact on our state of being. So that image that you just saw a second ago is definitely having, is an impact on our state of being. So this next image is also an interview room. So this image is also a space where someone who is distressed would be coming in to be interviewed. This is actually a picture of a child advocacy center. So this is where a child would be coming in to be interviewed after having either witnessed or being the victim of something very bad happening. And they're coming in to provide details about the bad thing that may have happened. So again, this individual is coming in, just as that other room, showed, in distress and feeling a lot of significant emotion. But in this setting, the lighting is different. You get a sense that it feels a little bit more, I would say like cozy, but it's just a little bit warmer. There's that kind of awning that's up at the top of the screen there to kind of give a sense of kind of this more of just kind of this comforting feeling. There's a stencil, the tree and the bird kind of stencil that's on the wall that is a little bit more warm and inviting. There's a pillow on the chairs. You know, having, a pillow, and I know like with COVID, unfortunately, that has impacted some of our settings, and we can't always have some of the same materials right now as we would have in the past because we need to be able to clean them and things like that. But, having a pillow sometimes can help people when they're having to talk about hard things. You often find they'll put the pillow in front of them. It's almost like this extra barrier that kind of helps that they can hug or hold on to. It makes them feel a little bit safer when they're having to share hard things. Um, there's also some fidgets on the table. It's hard to see, but those are some fidgets, some things that the individual can kind of hold on to. And we actually still use those even during COVID. We just wipe them down after. Um, but that something that, again, just something tangible that the individual can kind of hold on to and fidget with while they're having to share something really hard. The lighting is a little bit different and just the colors, and there's just more natural elements in this space to just make it a little bit more soothing. Um, and none of this cost a lot of money. This, adding just these few small touches made a huge impact. Again, you're not going to take away from the hard things this individual has to share, but you can maybe lessen the stress just a little bit, or maybe not be adding more stress because your physical space just is not appealing. And this is just another room in a building where, again, they tried to incorporate some other natural elements. So just using, an image of a tree and a light that just, kind of whenever possible, like just the use of nature can help with, self-soothing. It's hard to see, but at the right below that tree image, there's a small white thing on the floor, and that's a sound machine. So using, whenever possible, like a sound machine that can also add with people feeling safe. So it can add with confidentiality. So whenever you might be in a setting such as social services, a doctor's office, um, probation office, if you're, school counselor, any of those types of settings, having a sound machine, which just costs $20 outside, turned on, and then also explaining to the individual you're about to meet with why you have it on. It's also so that people aren't hearing, what you're about to share, and it kind of protects confidentiality. It's this other layer of just feeling safe and safety. And many times I've been in a doctor's office, either for my son at a pediatrician's office or for myself, and you can hear what's happening in the room next to you. So having, like even just some type of a sound machine or something like that can really help you just feel more protected when you're having to share, intimate details about something. This image, and again, I'm going to share this resource with you. This actually comes from a site that talks about trauma-informed spaces, and they had a couple kind of computer images that they were showing about a physical environment. Just to want to highlight just kind of a few things on here. We're considering kind of a physical space, and this is just a waiting area. And again, this could be a waiting area anywhere. This could be a waiting area in a library. This could be at a community center, at a government building, or a human service building. But some of the things that make it more trauma informed versus not trauma informed are there's flexible seating in the trauma informed area. And what I mean by that is, the seats aren't all confined. They're spread out a little bit more. If we're really being flexible, you think about like when you're at an airport, and if you're sitting in an airport waiting area, many times the seats are lined up like they are in the first image, where they're kind of these tight rows. There are kind of arms on each chair. You're kind of confined and kind of trapped, especially if it's a very crowded space. There's not a lot of options for you to kind of move. And or if you have, say, a child with you, there's not an opportunity to be able to kind of snuggle with the person next to you because you've got this big arm in front of you. So depending on your space, if you have an opportunity to have flexible seating, it can really make a difference. It gives that person choice. Remember, that's one of those trauma-informed principles. You're giving this person choice or options. So if they want to sit in a space where you have a chair with arms, they can do that because that might make somebody feel more safer, to have kind of be more kind of confined. But for others, being able to have a little bit more physical distance and might make them feel a little bit more safer. Or to be able to actually sit with your child. So having an option where there are like some spaces where there aren't any arms and you can actually be able to sit with your child. Instead of tightly on your lap, can make a difference. So having flexible seating options is always helpful. And again, whenever possible. This second image that's more trauma informed has incorporates kind of a plant. There's some natural elements that have been added. So again, there's lots of research that talks about, having these natural elements can help with creating spaces that are safer, that are more self-soothing, that are more relaxing, that help to reduce stress. If you think about like if, an individual is often coming into these settings, and again, they have that invisible backpack on. They're coming into this setting with lots of stuff. You don't know what happened to them that morning. You don't know what's happened to them in life, but they're coming in often with this invisible backpack. And they might be coming also to your setting for something that might be somewhat distressing. Whenever possible, can we help to lessen that stress? So can we, in this physical space, provide things that will kind of help to reduce some of that stress and help make that person feel a little less distressed? So one of the things on that, the image of trauma informed, is that there's clear signage. So you can see there's a sign that says welcome. There's another sign that says exit. Many times in our settings, the signage isn't always clear. And I'm thinking sometimes of our larger buildings. So sometimes of our government buildings or healthcare, for example, you're going into a hospital, or sometimes the signage isn't very clear. And that's sometimes adding more stress. Sometimes our parking situation in front of our buildings are not clear or is confusing. And even just that can cause additional stress to someone who's already carrying this backpack full of stuff. So whenever possible, we should be trying to make clear signage. Or if our parking lot is confusing and it is hard to find the building, can we make sure that we have something on maybe our website that explains how to find our building? Or when we're having to do a phone call to that person that's going to be coming to our space, can we make sure that we let them know on the front end how to find our building? So just these small things can make the experience a little less stressful. I know when I was working with a local pediatrician's office in Richmond, they had me come in to take a look at their physical space because they wanted to make some changes and to make it more trauma informed. I started my kind of scan of the physical environment out in the parking lot because I wanted to put myself in the shoes of a patient or a caregiver who might be entering that space. So I started in the parking lot. So even when I pulled up to visit this setting, I sat in the parking lot and I thought, okay, if I'm coming in and I'm already stressed, or is there anything out here that might be, inadvertently causing more stress? And one of the things I noticed right off the bat was to enter this. So if you park in this parking lot, this pediatrician's office, the entrance is right in front of you. but there's like 6 stairs you have to go up. Well, if I'm coming in and I'm in a wheelchair, or I've broken my leg and I'm on crutches today, like, how am I going to get up these stairs? And so right there, there's no signage that explains that there's actually a side entrance that has a ramp. Well, I wouldn't know that if I pulled up to this setting. I would have sat there trying to figure out, like, stressing out, and maybe I have a child that I'm supposed to be bringing into the pediatrician's office. So now I'm on crutches, I have this broken leg, but I'm also have my child with me that I've got to bring in for their checkup. These stairs are causing me way more stress right now, because there's no signage to tell me that there is a ramp on the side of the building. So just adding a sign that says that there is a ramp on the side, and to go this way, like, would have lessened my stress. Or when I called to make the appointment, if the administrator who's making the appointment told me or asked a question, do you need any accommodations for, or to let them know that, we have stairs in the front of our building. Do you need any other accommodations? And, that would be an opportunity for me to say, yes, I'm actually on crutches. They say, oh, well, we have a side entrance. So when you park, go to the side entrance. So right there, like, that would have lessened the stress that I might already be carrying. So when we talk about our physical spaces, you should be walking around them with this lens of, are there things in this space that might be adding more stress to what I'm already carrying? And again, that starts in the parking lot, not just even in your physical space. Once you get in a setting, again, like, is the signage clear? Or if it is a large space, like a government building, is there someone to greet you? Or if there's not someone to greet you, is the signage very clear and transparent and in, multiple languages? If there's, multiple languages spoken in your region, are there, what does accessibility look like for people with all different types of abilities? So just making sure that things are that you can navigate them easily. And we could keep going on and on and on with the physical space. But one of the things that I'm going to share with you, that I'm going to send to Patty, is a document. I have a couple different documents where you can kind of do a physical scan of your environment. And again, this could be any environment. So this could be a library, this could be a hospital, this could be the Department of Social Services. But just, and again, the scan, it's just things that you might, the way the scan is, or the document is set up, it's things to consider in your space. You don't have to have all of these elements in your space, but it's really just looking at, things that you might want to consider having, or just, are there things that are causing more stress that maybe I could take away or tweak a little bit to make it less stressful? You might not have a budget to, paint all the walls and put a million plants in there. I'm going to show you an image here that was just really pretty. You might not have a budget to be able to make your space look like this, but are there opportunities where maybe you could incorporate more natural light, or, switch some of the images that you might have on the wall, to be more culturally sensitive and really meet the needs of the community? If there's opportunities, like you said, for flexible seating, and it might not be going out to the, store and buying all new furniture, but maybe you could just rearrange the furniture you have in a different way. So again, not all these things have to be costly. There also might be things that you're doing really well, and doing that scan might just validate why you're doing some of this stuff, and just remind, yourself of, look, why it's important and things to consider. I'm going to pause for a second because I'm going to switch gears in a minute. So does anyone have any questions about kind of the physical environment or the physical space? one of the things I noticed when I was working with a local Department of Social Services, they'd asked me to come in to look at their space. They were actually um, in the process of actually doing some redesigning of their waiting area. And because they were going to be making some changes, they'd asked if I would come in and also just give it kind of a once over and see if there's anything that I might notice that they might want to tweak. And one of the first things I noticed was the television that they had going on in the waiting area. So this was a waiting area for social services. This was for people, and it was just a large waiting space. And people would be coming in there either to be waiting to see a child welfare worker, or they could also be coming in the same waiting area to meet with a benefits worker. So might be coming in to talk about Medicaid or talk about SNAP or WIC or some other type of services that they might be receiving. But the television had CNN on. And I'd been in that building multiple times, and every time I went in there was always the news. It was always some news channel that was playing. And if you turn on CNN or any of the news channels, it's usually not good news that's airing. And these are individuals that are coming in often with multiple children, and that are all often coming in distressed. Like they're not coming in oftentimes because something good is happening. Sometimes they are, but a lot of times they're coming in because there's something stressful happening in their life, and that's why they're needing to come to social services. And having the news on constantly, kind of on a loop, is not helping to lessen any of the stress. And so that was one of the first things we just kind of noticed was just, can we put a different channel on? Can we put some other type of something on that's not super distressing? So again, like it could be anything in the space, but again, just keeping that lens of, are there things here that might be just making things a little bit more stressful? I'm just going to talk about this briefly because I know this does not apply to a number of you that are on this call today. But there are some of you that are on the call that do work in a space where you might be doing some interviewing of individuals who are coming to your setting. You might be either currently doing some type of a screening for trauma, like you might already be asking some questions about someone's trauma history. That could be a child or an adult, or you might be considering adding some type of a screening questionnaire to the work that you're already doing. Just make sure you're muted if you're on here. So one thing that I want to go over, because I have done this training for a number of different types of systems, and one of the first things that some of the systems that I've worked in that I've wanted to do is to add a trauma screening. And it often comes from a good place. They often want to, the motivation is often, we want to make sure that we are, identifying, if someone has experienced this, so we can make sure we're, getting them the help that they need, or that we're getting them the appropriate services. So sometimes the motivation is coming from a good place, but sometimes the way this screening is implemented, sometimes it happens without some of these other things being considered. And when we do a screening of any type, this is also a time when you can potentially re-traumatize somebody. So we want to be really careful if we're working in a setting where we might be considering adding a screening for trauma. So I put this together a while back of just some things that you should consider before wanting to put a screen. So you really should be, making sure that you're having conversations where you kind of answer some of these questions before you actually go to implement some type of a screening. So the first one is really, why do we want to screen? Is it because we want to better identify what might be going on with this individual? I've worked with healthcare settings and they've decided, determined, well, we really want to start asking more questions when we're gathering a history on a child or an adult. We want to do a better job of also asking about potentially traumatizing events they may have experienced, because that might help us to better diagnose and treat what might be going on. So we want to get some more information. So we might be adding some type of a screening. Um, Worked with other settings like juvenile justice or even child welfare that have started to add some additional screening, so we can make sure we're better serving or getting these individuals better connected to appropriate treatment, right? So making sure you understand like why you're screening and if it's coming from an appropriate place, but then also identifying who's going to be doing that screening, because whoever is going to be asking those questions, it could also be very triggering for that individual, because as we know about trauma, many of us are carrying a lot of stuff that we've experienced. So it's not just those we're serving that might have experienced trauma, it's also us. And when we're having to ask questions about someone's trauma history and we're now hearing details from somebody, that can be triggering for ourselves. So just making sure that the person that's giving the screen is well trained, is well supported, knows how to ask hard questions, um, knows how to pace the questions. It can be, your experience of being interviewed can be very different depending on how someone is asking the questions. So if you have somebody that, is holding up the piece of paper and just dives right in to asking these hard questions, did you ever experience abuse? Were you ever, victimized in any way? And they start giving you, getting more and more specific. If they just start peppering you with questions, that can be pretty, jarring. It can feel often sometimes threatening. You can feel very vulnerable. Um, how you set up the question can make a huge difference. Um, so even if if you have to ask hard questions, just the way you set it up and let people know, I'm about to ask you some difficult questions or questions that might bring up a significant amount of emotion. I need to ask them as part of our screening. They may be hard. I just want you to know at any point we can stop. If you want me to pause, I can. Um, a lot of us have experienced really hard things, so I'm about to ask you some questions as well. Um, and then, kind of then leading into the question. But the way you set it up can help lessen the stress on that person who's about to share some hard things. So training for the screener is very important. Then also thinking about the location where you're screening. Are you just doing it in the waiting room in view of a bunch of people? Are you doing it in a closed space? Is it a confidential space? So just thinking about where you're screening, and then what are you going to do with the information if somebody shares like, yes, and it endorses that they have experienced a bunch of these traumatic events, then what are you going to do with that information? So do you have somewhere to connect this person to? Do you have resources in your area for this individual to go to? So making sure before you're opening this person up and having them share all this stuff, that you have a plan, because now this person is in a very vulnerable state, and may never have been asked those questions before. So just be prepared to know what to do with the information. And then there's some additional, I'm not going to go through all of these right now, but just additional things that you should be just considering before putting this in place. But I know when I've worked with a lot of different organizations in systems, screening often rises to the top when they're talking about wanting to be a more trauma-informed organization, because it's something tangible. They could say that, oh, we put screening in place, or we fixed our physical space. those are things that often people can grab onto. What sometimes is harder to grab onto is actually how we change our individual practice, with our clients or with the people that we're serving. And that actually takes a little bit longer time and more training and support. I'm not going to spend much time on this, but I referenced the term psychological safety before, and I just wanted to make sure that I did include some definitions if you haven't heard that term before. So when we talk about, creating a trauma-informed setting, like an organization, we said we want to focus on safety, not only physical safety, but psychological safety. So that can be in the physical sense, but also in just in the way we're interacting with one another and the culture of our organization. So I think these definitions do a nice job of really kind of explaining, like, if you are creating kind of a psychologically safe kind of culture within your setting or within your team or your colleagues, this is kind of what we're talking about. That people feel safe to share ideas without being judged or humiliated or punished. That you're able to make mistakes. You're still supported. That you kind of are in a space where you're not shamed, where your voice is valued, where there's collaboration, there's mutual support. Again, those are those trauma-informed principles again. So you're in a space where, it's collaborative, that it really is a team, and that the way we're engaging with one another is in a healthy, not toxic kind of way. So that's what I mean when we talk about psychological safety and the culture of an organization. These are what you should be hopefully trying to strive for within your team. And this is for any setting. So from a library to a government building to the human service field, counseling, this is what we're striving for in the culture of our setting, especially for being more trauma informed.
Melissa, there's a question in the chat.
Sure.
They asked, is it appropriate to ask employees to take the ACEs survey?
That's a really good question. I appreciate you asking that, because that's come up before. So there's different schools of thought on this. If you were to consider asking, say, staff to do a survey such as that, that can be really triggering for an individual, especially if it's someone who hasn't really ever talked about that kind of information before, that has never shared this stuff. I mean, you can feel, it can be very vulnerable, and not safe, and sometimes threatening if you're having to be exposed in that way. So having an actual, a survey where you're surveying your staff, you want to be kind of considering all of that, right? What a lot of organizations have done, though, is just make people aware of what it is, and also to understand that the ACE survey talks about 10 things. There's a heck of a lot of other things that are just as traumatizing, if not more, as well, that can also have a long-lasting impact. So, which kind of speaks to why we talk about the importance of just grounding everybody just in a general understanding of trauma and resilience. So doing some type of a training or onboarding or kind of an awareness event for all staff, regardless of position, about trauma and resilience. Because in that training, they're going to talk about the ACE study. They're going to talk about what are potentially traumatizing events and how we may be impacted, but also how we build resilience. So it's kind of it's a better way of kind of making people aware of all the stuff we're carrying, rather than just giving a survey out which can be kind of a, like I said, it can be kind of alarming. And it can also be, again, if somebody takes the survey and is like, oh my God, I'm a 9, you know, what does that number mean? And you don't know the type of, again, the response that individual is going to have or what they're going to feel like after that. And if that, and just because you've been 9 doesn't mean your life is over, but that might be what you might consider if you've never heard about this information before. It could be terrifying. So you just want to be careful with any of those screens. And it's the same for when we're talking about this with our clients as well. Just helping them understand, why you're asking this information, what you're going to do with this information, because it can be very emotionally distressing. But I appreciate you asking that question because that has come up before. And there have been some organizations that have surveyed staff, kind of put that in, and they did it anonymously. And there were a lot of mixed emotions when they did that. Any other questions?
There's a comment in the chat I could share.
Sure.
They said if the individual is going to ask others to complete the survey, I think it's important for them to have done it as well for themselves first, so they do not get triggered while doing it. And then another comment and question. In creating a psychologically safe place, one of the barriers, it seems, is that not all organizational leaders are psychologically healthy or skilled. Is that a barrier to creating a trauma-informed organization? And any suggestions on how to circumvent that?
That's a great question. If leadership, isn't really bought in, if they're not really practicing this themselves, it can be really challenging for this to be sustainable. You can definitely change your individual practice on your own, but to have a healthy work culture, it does take everybody to have a role in that. So, trying to, part of it is trying to just continue to spread awareness about this information and hopefully getting more buy-in, and spreading that information in various methods. So again, not just from doing one training, but just like this continuous, like we call it like dosing of information, like a little bit of at a time, like hopefully will help to shift an individual's perspective. But unfortunately, it's not always going to work, and there's some settings where we've just seen where it just hasn't changed until that person left. So unfortunately, it's, it's not going to shift for everybody. But, hopefully the more people that do start to kind of buy in and have a greater understanding will start to shift their perspective. And we've definitely seen individuals, even with our Greater Richmond Trauma Informed Community Network, there were some individuals that had joined at the very early end, and that really were very hesitant to kind of buy in and to hesitant to really make changes, and we truly have seen them shift perspective over time. And some of them have talked about the change that they've had, and have talked about how early on, they thought that this was, there's no way we can do this stuff, or, there's not enough time, or there's not enough, they had a lot of reasons why they didn't really want to implement any changes into their setting. But then over time, we did start to see a shift. So again, it's not hopeless, but yeah, you're not necessarily going to be able to get everybody to buy in. One thing I do want to just say real quickly about the ACE survey, because again, this has come up, especially as people become more aware of the ACE study, and it's talked about in different venues. So there's different trainings, there's different, like documentaries or things like that where it comes up. is just to remind individuals that the ACE survey is a research tool. It isn't a screening tool. It's a research tool. It was used during the research for the ACE study, the Adverse Childhood Experiences study. It's not meant to be used as a screening tool. There are trauma screening tools that are out there that incorporate questions about people's past trauma. And there's often a lot of training that goes into those tools, those screening tools. But I have seen some settings where people have taken the ACE survey, because you can get it online for free. Just Google ACE survey, it pops right up, the 10 questions, like what is your ACE score? I have some people seen, take that survey and then start to implement it at their setting. So again, I really refer you back to that slide that I had about things to consider before ever putting any kind of screening tool in place. But there are actual screening tools out there that have been created that also have some training attached to them. Okay. I'm not going to spend much time on this. I just wanted to also mention, when we're talking about a trauma-informed organization, particularly if you're in a setting that's doing direct practice. So not so much, a community type of a building, like a library or government building or something like that. But if you are working in a setting that's doing more direct practice, having some type of mechanism for debriefing or supervision is really important. That opportunity in a reflective manner, that an opportunity to be able to support staff in a way. So especially if we're talking about trying to create a culture of wellness for our team members, you want to make sure that you have some type of a mechanism. And often in the human service field, we call it supervision, but it's that opportunity where you're meeting with your supervisor, where you're getting support. And it's an opportunity to debrief and to check in and to process. That is definitely a more trauma-informed approach to helping to maintain a healthier workforce. Now, it definitely is important if those supervisors have received training around trauma-informed supervision or how to provide that space, because not all supervisors know how to do that. So if you're considering, again, like trying to make changes in your setting, there's a lot of training for supervisors that are out there on how to be more trauma-informed in the supervisory relationship. So I do some of that training in the Richmond area, and there's a lot out there around reflective supervision or these type of more trauma-informed supervision models. So just, again, something to consider if you're in a setting that's doing more direct practice.
Melissa, there's another question in the
Sure.
chat. Do you have a favorite screening tool?
So the Greater Richmond Trauma-Informed Community Network created a screening tool committee a few years ago, because we had a lot of members who worked in kind of direct service that were interested in kind of implementing a tool. So we created a work group because we didn't know one tool from another at that point. So we created a work group that just did a lot of research. So they were meeting on a regular basis to just see like what tools are out there. And they went through a lot of the different tools. And there was one tool that we thought was really well constructed and also had a really good training component. And it was created by Duke University. It's called Project Broadcast, Duke University. It was like this project they had done. And it was a tool that was used primarily in their departments of social services. Although now that tool, it's been expanded to other types of settings, but initially most of the research and the data was collected from using it in the Department of Social Services. So we reached out to them. It's literally called the brief screening tool. So it's brief, and that's why we liked it. We also liked it because, and these were questions that were specifically for to screen children. So this wasn't necessarily meant for adults. So it was for people that were working in settings that served youth. And it just it added 4 additional questions to whatever intake or assessment you might already be doing. So it was adding these additional 4 questions, plus it had a list of behavioral indicators. And we like that because it's, many times an individual doesn't feel safe for many different reasons to share what's happened to them, especially a child. So these behavioral indicators were just additional potential red flags that could, and again, potentially indicate that that youth might need a further, evaluation by a mental health clinician. So again, a screening tool is not meant to be done by a therapist. It could be done by um, any individual who's had proper training, but it's meant to just basically identify whether this person needs further evaluation and potentially referral for services. So, so we started piloting it for the last 2 years at 5 local departments of social services in our area. So we've gotten great feedback and they've gotten great data. And it's actually what they started to do was to initially pilot it in our child protective services cases. And then now it's also been expanded to a foster care. And it's been able to they've been able to identify like additional things that this child may have experienced that they didn't realize, and it's helped to better serve these kids and get them the appropriate treatment or services. So again, there's lots of tools out there. If you're interested in getting more information about that, I'm going to share my contact information at the end, and I'm happy to have an offline conversation with you about that, and could connect you to those that are already doing that, using that tool. Okay, so I want to be conscious of time. And as I said before at the very beginning, I was going to end with kind of what are these next steps. So if you are, much of the time today was really focused on if you are considering being a trauma-informed organization, here are some of the elements that you would start to be including or doing within your setting. But then where do you begin? Where do you start? One of the first, and we've worked with a lot of different types of organizations. It really first starts with, as we said earlier, you really want to try to get buy-in from leadership. If you are just kind of coming in at the bottom, this isn't going to necessarily be sustainable. Everybody has an opportunity to make individual changes themselves, but at the same time, to really make a culture shift within an organization, you definitely need buy-in at the top as well. So it often starts with, conversations with leadership. If you are in a leadership position and you're considering making some changes within your setting, it's important that you make sure that you're communicating, why you're doing this and the information about this, about these changes with your staff. That we're not just kind of coming in and making changes. Again, you want to make sure that you go back to those principles again, that you're collaborating, that there's voice and information and input. So you want to have some type of a rollout announcement, or maybe even an event to help to help staff understand why we're doing this. Why we might be asking you to make some changes in your practice, or why you might be noticing some changes in some of our policies or procedures. But you want folks to understand the why, why this matters. You really want to get people to buy in, because many of us have worked in settings where, new policies have come out and they're just kind of told to us, and to really get that buy-in, it really helps to people understand why. Again, going back to the principles, being transparent, being, so helping people understand what you're doing, being transparent, that there can be some trust. So some of those announcements that we've done or rollouts have been, talking about in a staff meeting, or maybe doing a screening of the documentary Resilience, which kind of helps to people to understand what this is, or doing a training and then having a conversation after the training about why this matters and why we care about this at our organization and why we might be doing some changes. But also one of those first steps though is kind of doing an assessment of your organization. You want to get some baseline data. You want to figure out, before we start diving in and making changes, we want to figure out, what are we doing well? What do we already know? There's probably things in your setting that, that are good and that are positive and that are really helpful, but there might be some things that you do want to potentially change or tweak. So using some type of an organizational survey is helpful. And this is what I'm going to include in my resources tomorrow that I send out to all of you, are some examples of organizational surveys. So it's just a survey that all staff, regardless of the level that you might be in an organization, but all staff would complete, that gives you some baseline data on what people know and just the different practices and procedures you might have in your setting. It's also great if you have an opportunity to maybe even do some focus groups. It's just another opportunity to collect feedback and input from your staff and from those you serve, or other, maybe even community providers that interface with your organization. You want to have that collective input. Again, that's one of those trauma-informed principles. And from people with lived experience. So you want to make sure that you're getting, just a wide range of data and information before you dive in and start making changes. Doing some type of environmental scan, as I shared before, is helpful. So kind of walking through, it's really like a walkthrough. And it can be, like a small group of you kind of doing a walkthrough of your physical space with that lens, and kind of walking through and looking at your space and seeing, okay, where are the areas that might be causing more stress or might be adding more trauma? Where are the spaces that we're, might be doing a really good job? So really just identifying just these just opportunities, within the physical space to potentially make changes. And then you might be looking at just, what are our current policies and procedures? What is our onboarding process for new staff? What do our job postings look like? What does our web page look like? What do our values and mission statement look like? Is it consistent with the culture that we want to have at this setting? Does it reflect what we're trying to say and do in our setting? Is our onboarding procedures, do we even have any kind of training around, trauma resilience? Do we have any, information about that in our policies, in our procedures, like I said, in our job posting, in our interview process? Because all of that reflects the culture and the philosophy of your organization. So you're kind of gathering all of that information on the front end before you're making changes, because you want to have a good sense of, again, like just this baseline data of your setting. And then from all that information, you're then kind of, coming up with a list of recommendations and prioritizing which areas you want to make changes in first. And again, it's going to look different for every setting. It can sometimes feel very overwhelming, but you really want to just you start somewhere. And then I'm going to be real quick because I'm conscious of time. Again, just, any opportunities, like, once you start making some changes, it's more than just doing a one-time training and that's it. That's a good start, and that is a good practice to have. But how are we continuously getting this information out through various methods? Because if you really want to see people to shift their practice and to shift their approach with their staff, with their colleagues, with those they're serving, the community, we need to have ongoing exchange of information about this stuff on a regular basis, or else people are going to forget it. So do we have, is there information on the walls about it? Does it go out in an email? Do we have a monthly newsletter? Does it come up in meetings? Is there, there should be this, like I said before, this small dosing of information. So not just this one-time training, but little bits, incremental, kind of over time. That's going to help to really shift people's practice. And then considering, maybe developing some type of a internal work group that's focused on this stuff. So it's often called a trauma-informed leadership team or a TILT team, but it's an internal work group at your organization whose focus is to really look at the data and try to help to move this stuff out and to look at those priority areas. So maybe you want to start with staff wellness. Maybe that's the area that you're the most concerned about. Well, that work group could really start focusing on what could that look like here, and maybe start to develop some recommendations and start to actually come up with some ideas of things that they could potentially change. Maybe it is screening that you want to look at, or maybe it is the physical space. But that work group could help to really have those consistent conversations about this stuff. That really helps to sustain this work. And using your network, using your, Healthy Communities Network to really come back to for learning exchange. Especially there's lots of different organizations on this call today, but to be able to come back to your meetings and talk about like, hey, we started to make some changes at our setting, but we're running into this roadblock. Has anyone dealt with this before? Or we really want to address staff wellness, but we have no idea where to start. What have you guys done? And then, that's really where we've learned so much, is from other organizations who've started to do this work, and really that information sharing and sharing of ideas and new initiatives. All right. We are at time. Any last questions, comments before we kind of wrap up? Okay. So I'm going to, as I said before, share my information, the resources about organizational assessments and environmental scans with Patty to send out to all of you all. You'll also have all of these slides. Definitely encourage you to reach out if you have any specific questions about things that came up today. I know it was a lot of information, but if you have specific questions about me making changes in your setting or anything like that, please don't hesitate to reach out. I'm happy to jump on a call with you to go over all that information.